For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Today we have 2 guests here from our new family center at St. Tammany Parish Hospital to talk about improvements they've been making to mother-baby care for all of our patients. Our first guest is Sharon Moore, a registered nurse at St. Tammany Parish Hospital. Welcome, Sharon.
Thank you.
So I know y'all been making a lot of changes to kind of improve the mother-baby care and the bond between the family and all of that at the new family center. Can you tell us a little bit about that?
Sure. This is movement towards trying to get a baby-friendly designation. It's USA Baby-Friendly, Baby-Friendly USA, I should say, and they have researched what is best for mom and baby, and that research has shown that keeping the mom and baby together really improves bonding, breastfeeding, the care, education, and knowing how to take care of your baby. So we brought that back to St. Tammany, and we want to be baby friendly, and we want to just really improve the care for our patients.
Okay, so I know one of those initiatives is something called Rooming In. Can you tell us a little bit about that and why it's important?
Sure. So it goes back to way long ago where there really wasn't any nurseries. The babies were always with the mothers. The mom was always taken care of together as just with one nurse maybe. But there wasn't a nursery that the babies kept going back to, and the mom stayed in her room and the baby is separate. They have a baby for a reason, to grow a family, and they wait 9-10 long months to actually meet this baby. Why would we want to take their baby away? We feel like, and they have to go home with the baby. So even for those first-time moms, we feel like it's really beneficial for them to be in the room and learn such things as feeding cues. They can see the baby making those feeding cues signs and feed the baby on demand, and that will help milk production, it'll help the baby gain weight, it will reduce the jaundice. There's so many beneficial facts. Research actually shows that they sleep better with the baby close by instead of in the nursery. I don't know if it's just like a mind thing, but the baby's close by and they feel relaxed and they feel like the baby's safe next to them, and they both sleep better. Baby feels relaxed because they smell mom, and the baby sleeps better. So, and not only that, if they're close by and they're showing those feeding cues, the mom will feed the baby and the baby will be more satisfied instead of staying in the nursery and not getting fed as frequently.
Okay.
There's so many beneficial points to it.
Okay, and something you mentioned is that they have to go home with the baby. So is that a big thing, kind of teaching the parents, like, when you get home, there's not going to be a nursery to send the baby to?
Yeah, absolutely. And it's not really tough love. It's really just helping them out.
Right.
Like we don't want to surprise them. We want them to feel comfortable at home. We are their advocates, and as a patient advocate, we want to say, this is what you need to do. That we want you to feel comfortable. We don't want you to be scared when you leave the hospital. We want you to feel competent and confident to take care of your baby, to breastfeed your baby, to put your baby to your breast without, an improper latch. We want to be able to teach all those things in the hospital for them to be comfortable going home.
Okay. I know another initiative y'all have is skin-to-skin contact. Can you tell us a little bit about that?
Sure, that starts off right after delivery. So the very first time that they meet the baby. And I wish that they had that when I had my children, but they didn't, and that's okay. I still have a close bond, but there's nothing more beautiful than to have a baby delivered and to go straight to mother. There's really nothing better than that. If baby's stable and mom is stable, even if there's a little bit instability, they can be stabilized at skin to skin. Research shows again that skin to skin contact improves their heart rate. It regulates their heart rate, both mom and baby, temperature. It decreases the stress for both of them, and baby can smell mother and start working its way to the breast and start breastfeeding within that first hour. It really is a beautiful thing. So we try and do the skin-to-skin contact if mom and baby are both stable, for that bond to start right after delivery.
Okay, so it's immediately, like the baby isn't cleaned or anything, it's just immediate skin to skin.
That all happens on the chest.
Okay.
Mhm.
Oh, that's
And
awesome.
mom can kind of take part in that care, and dad can too. And it's all right here in the chest. And a long time ago, I heard at one of the conferences I went to, somebody else had said heart to heart, and so the baby's heart is to the mother's heart. And so I just, I think that's just really special.
Right. And is it something that can be done both with a natural delivery and C-section?
Sure. For a natural delivery, it's much easier. You know, there's that direct, that the mother's chest is open, she's laying back. It's very natural for that process. For C-sections, it's a little bit harder, and only because she is on an operating table, and we do have to take that into consideration because it is a sterile environment, and it is a major abdominal surgery. So at that point, the mother is not really considered stable because she is on the operating table. But we never separate mom and baby anymore. We keep them together. The baby does not go back to the nursery until skin to skin happens. We really don't bring the baby back to the nursery at all. We keep the baby with the mother and the support person at the bedside in the C-section, and they wheel right into recovery together, and that's where skin to skin happens, because at that point the mother is stable, she's not on the operating table, and there is, the incision is closed and all that kind of stuff.
Okay. Can you talk a little bit about quiet time?
Sure. So I love this, actually. Quiet time is from 1:30 to 3:30. And it was just a good time to designate on our unit for our patients. We thought that it was a good time. It was kind of right before school let out, because we understand that a lot of big brothers and sisters want to come and visit their babies. So it's right before school lets out. So we kind of thought about that, but right after lunch, so they can eat lunch. And it's a 2-hour window that we do not interrupt the family, unless they call out, of course, if they need some help. But the nurses don't go in there, dietary doesn't go in there, housekeeping doesn't go in there. Nobody goes in there to interrupt them. It's their time to rest. We don't allow visitors at that time, because there's visitors that come and go all day long to those patients, and they don't know what a good time is, so they just kind of go at a good time that's good for them,
Right.
And they have no idea that the mother has been awake all night long, cluster feeding, and the baby's cluster feeding and breastfeeding every hour to 2 hours, so they don't know that they've been up all night. So this is a good opportunity for both mom and baby to rest and not have any visitors and interruptions.
Okay. And I know the newest initiative that y'all have started is couplet care, which you kind of mentioned a little bit earlier. Can you tell us about that and why that's so important and y'all felt was important to change?
Sure. So again, rooming in brings the baby to the bedside with the mother at all times. And so we thought that taking care of both mom and baby together would be more beneficial for both patients. The nurse has the health history of the mother. She'll learn the baby. She'll help she already has a bond with that mother, and so helping the mother breastfeed, helping the mother, take care of the baby, and then also know the problems with the mother, and trying to get that uterus back to its pre-pregnancy size. And when you're helping the baby to the breast, you can also give education to the mother at the same time about the uterus, shrinking down, and you might feel cramps. So it just kind of brings it all in together, keeping mom and baby together, giving that education together, and more cohesive. And I feel like, but research also shows that more education is given when moms and babies are taken care of by one nurse, a couplet nurse.
So it used to be where somebody would come in and check on the baby, somebody different would come in and check on the mom?
Right, yeah. So, our postpartum nurses would go in and check on the baby, go and check on the mom. How are you doing? How's the mother doing? And not even ask anything about the baby, maybe. And then the nursery nurse comes in and asks about just the baby and not about mom. And there's so much that is intertwined in their care. Breastfeeding leads to the cramping with the mother, and so I know that the baby needs to feed, so let me go and maybe give her an anti-inflammatory for her cramping to anticipate that. Or oh, mom needs a shower, well, let me do the head-to-toe assessment on the baby. Just timing that care a little bit better, maybe allowing them to rest a little bit better, and getting that continuity of care, having one nurse to ask those questions and really bonding with that one nurse.
Okay, awesome. Is there anything else that y'all have been doing to kind of improve that mother-baby bond and care?
We have been orienting our nurses, although all of our nurses have gone to nursing school, obviously. They're not really acquainted to, the nursery nurses might not be acquainted to postpartum mothers, and maybe never have taken care of those mothers and just have been in the nursery since nursing school, or vice versa. The postpartum nurses may have never taken care of a baby. So we're doing some education, some orientation for our nurses to feel comfortable and confident to take care of those babies and their mothers together.
Okay, great. Well, thank you so much for being here.
Thanks, Amanda.
I'd like to thank Sharon for being here. And up next, we have Nancy Ferger, a lactation consultant and registered nurse, to talk about breastfeeding.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Ochsner, collaborating in the name of community.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is registered nurse and lactation consultant Nancy Ferger, here to talk a little bit about breastfeeding. Welcome, Nancy.
Hi, Amanda. Thank you.
So Sharon mentioned earlier that we are doing a lot of things to improve mother-baby care at the hospital, and she mentioned that a lot of the things we're doing helps improve breastfeeding. So I guess, can you first tell us, why is breastfeeding important? I know it's something that wasn't always, the trendy thing to do, and so but it really is the best for the baby. So
No, it is, and the trend is changing. Our breastfeeding rates are definitely increased over the last years. But the benefits, there's so many. I guess, first of all, it's free. That's always nice.
definitely.
The cost is free, and then as far as the cost of being that you have a healthier baby means less visits to the pediatrician's office. But as far as health benefits for the mother, it decreases uterine cancers, breast cancers. The longer a mom breastfeeds, the incidence decreases.
Wow.
Obesity, diabetes for the mother. It helps you lose weight faster. That's a big one. After delivery, what has been shown is that it decreases the incidence of postpartum hemorrhage, because even when a baby is placed skin to skin, not even the act of breastfeeding, it helps the release of oxytocin, which is a hormone that contracts the uterus. Okay. So it's very beneficial there. As far as the baby, you know, really what you're doing for this baby lasts a lifetime. Research has shown that babies that receive breast milk are less likely to get childhood leukemia, childhood diabetes, so it's both mom and baby. Childhood obesity, that's a big problem in our country. Respiratory illnesses, diarrhea, higher IQ, the benefits go on and on. And it's shown that infants, children that were breastfed, it decreases cardiovascular disease for the long term.
Oh, wow.
So it is just, it's amazing, and it's so important for a good start for the infant.
Okay, and can you talk a little bit about, I know it also helps mother-baby bond.
It does.
Can you talk a little bit about that?
It does. You know, whether for the breastfed baby or for the mother who chooses to formula feed, starting off with just skin to skin, you know, our baby-friendly initiative applies to all babies, no matter how they're feeding their babies. So the initial bond is going to take place for every mother, initially skin to skin. But the act of breastfeeding, if you talk to mothers, it definitely increases the bond. It's something special. It's something that only a mom can do for her baby. So it started from the very beginning.
Okay. I've heard in the past that everybody's breast milk is different and that your breast milk's kind of made specifically for your baby, which is one of the reasons that it's so good for them. Can you talk a little bit about that?
That's right. Really, every you know, mammal's breast milk is species specific. Our milk is different than feline milk, and it's made specially for that mammal. But each mother's milk is special for her own baby. The nutritional components of breast milk, which is so interesting, just like the milk that babies receive in the early days, the colostrum, is made specifically for the needs of that newborn. And then as the child grows, our breast milk changes to meet the nutritional needs at that time in the baby's life. That's, to me, pretty impressive. You know, it's very, very important.
Okay. I know something that I've heard from people that's really important is to have a support system while you're breastfeeding.
Yes.
I know it can be, I think that's probably what scares some people, is that it can be difficult. And
That's
so can you
right.
talk a little bit about what people need from a support system?
Well, you know, you need to have, you know, whether it's your partner or your mother. A lot of grandmothers may not have breastfed their children, but that's okay. Back in their generation, it wasn't popular. We didn't know, the research wasn't out there. So you really have to have your significant other be there, not only to support the act of breastfeeding, but to support the mother for rest, doing things. And that first 4 to 6 weeks is probably the most challenging. Moms are tired, so you have to have somebody support you with breastfeeding, but in other ways, so mom can rest. We have support system. We are their support system. I tell all my patients, once you leave the hospital 7 days a week, there's always a consultant on. And sometimes it's 24 hours a day when one of our consultants, Cheryl, works at night. All of our nurses are educated in breastfeeding. With our baby-friendly initiative, one of the a part of it is education of breastfeeding for all staff. So most of the nurses, you know, even if they get a phone call, can answer mom's questions, but if they need to talk to us, we're available. We have a support group at the Parenting Center. We have 2 of our nurses who know they're not board certified lactation consultants, but they're breastfeeding educators once a month. There we have free breastfeeding assistance, drop in any patient, and not just patients who deliver at St. Tammany, any patient in the community if they need hands-on breastfeeding assistance every Friday afternoon. So you really have to have people who are supportive, who are knowledgeable about breastfeeding, because there's a lot of misconceptions.
Okay. And I guess, how long do you recommend someone breastfeed for?
A lot of patients ask me that, and I said any breast milk is better than none. They have to, but I always tell them what the guidelines are from the American Academy of Pediatrics, and they suggest as long as the baby's gaining and thriving, you can give exclusive breast milk for the first 6 months of their life. And then at 6 months, complementary foods are introduced, and that's something the pediatrician will go over with them as far as cereals and baby foods. And then the statement says to breastfeed for the first year and thereafter as mutually desired. Unfortunately, breastfeeding rates tend to, when you look at statistics, at 3 months, a lot of moms go back to work. And it's a challenge. Moms do it, pump and still provide milk, but it's a challenge, it's hard, you know. And so, but as far as the recommendation, when people ask, we go by the guidelines from the AAP. But you know, whether a mom can give breast milk for the first month or for a year and a half, it's all good, you know.
And you mentioned pumping. Is that something that y'all also help with?
Yes.
You know, teach them how to do it and that sort of thing?
We do. You know, moms who are separated from their babies, we initiate pumping, which is very important within, you know, the first few hours. For moms who babies go to the NICU, we do pump rentals for those mothers who don't have a pump. Hospital-grade pumps are important for mothers who are separated from their babies. A lot of patients bring their pump in, and we'll be happy to show them how to use it, you know, even if they have to use it initially, if they're just to kind of set it up, we teach them about that. But pumping is an important part of a breastfeeding mom, because the majority of moms do go back to work. Right. And they can still, you know, it's stressful enough for them to leave their newborns. But at least when they go back to work, if they can still provide breast milk, they'll be a better employee because they feel better about that. There's less days missed of work, so so that's good. You know.
Do you feel y'all have a lot of patients that are able to go back to work and still pump and
we do
provide that breast milk?
We do. A lot of patients will. Sometimes it can be a challenge from one mother to the next, depending on their job and the demands of the job, whether it's something they can fit into their schedule. But we do have a lot of our nurses, you know, it can be done. It just takes a little extra work on a mom's part.
Gotcha. And so I guess from inside the hospital standpoint, what do y'all do to help mothers breastfeed while they're in the hospital and to show them what to do?
Well, as a lactation consultant, you know, really our job is to focus on the patients who have difficulties, whether it's a mom of multiples or just a baby who's having difficulties. That's our main focus, because all of our staff is trained to help mothers and they're knowledgeable about breastfeeding and teaching a mom how to latch her baby. But you know, our goal is to visit every patient every day and to observe the baby at least once to teach her about a proper latch. We teach them positioning, how to latch, how to make a good milk supply. You know, more breastfeeding means more milk. That's why rooming in makes a lot of sense, because the baby's right there. And with that, they're gonna breastfeed more often rather than being separated.
Okay. And I guess if a mom from the community needs help or wants to call y'all, how can she do that?
Anybody can call. We have a lot of patients call from Slidell, or patients who might have delivered out of the hospitals and they don't do, we're really the only hospital who does pump rentals. They'll call and then we'll talk to them about breastfeeding. Anybody in the community can call us. They don't have to be a patient of St. Tammany Parish Hospital. We offer outpatient services if need be, if most problems we fix over the phone and can guide them that way. But if it's something we need to do, we can make an appointment and they can come in as an outpatient and we can help them. It could be anybody in the community.
Perfect. Well, thank you so much for being here.
Oh, you're welcome.
I'd like to thank Sharon and Nancy for being here to tell us a little bit about the mother-baby care at St. Tammany Parish Hospital. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.